The joys of motherhood are indescribable. Regardless of the sacrifices and trials, there's no greater happiness. Yet millions of mothers across the country share one common complaint, that their bodies didn't snap back to their pre-pregnancy shape. Sagging, smaller breasts, and wider waistlines are at the top of the list. And no matter how hard some of these women work out, they just can't seem to get their pre-baby bodies back.
What happens to the woman's breast is changes that happen during pregnancy. They get larger, the fat cells get a little bit larger, and they make the glandular tissue a bit smaller. And when that happens after pregnancy, when the glandular cells actually go down, the remaining fat cells are that much smaller. And what happens, you get a little bit of droopiness and you get loss of volume. The changes that happen to the midsection is during the pregnancy, the belly actually gets larger to accommodate the baby, and there's tissue in between the two muscles of the abdomen, and that tissue gets stretched. No matter how much you work out, no matter how much you get back to the gym, that tissue in between will never get tighter.
A generation ago, these physical changes didn't emotionally affect many women. But today's women express feeling less confident and embarrassed by the new shape their bodies have taken. In response to this, plastic surgeons like Dr. Tehrani are offering what's called the Mommy Makeover as a solution to these problem areas. Breast augmentation and body contouring procedures like the tummy tuck are among the most popular procedures Dr. Tehrani performs.
The good thing about doing a combined procedure or a mommy makeover type procedure is you kind of get a free recovery for the other things that you do. Your body does this thing called the distraction injury. When you have an abdominoplasty, that's the more painful part of the procedure to a certain extent. And in a way, your body kind of lets you forget about pain that you may have in the breasts. I'd like patients to take off at least a week from work so they can concentrate on healing. They'll be walking a little bit bent just to brace themselves in the abdominal area. But after about 2 weeks, part of it is a social thing. If you don't want anybody to know you did anything, you don't want to walk around bent to a certain extent. Overall, it's life-changing. The feedback is very positive. Patients love having these procedures done.
Oh, my social life is wonderful. It's very, very good. I mean, I had a great social life, but now it's like even better. You know, I feel invigorated, I feel happy, I feel sexier, you know, I feel great.
There's two ways of looking at why I'm so passionate about this. First and foremost, the patients that I serve, the patients that I actually do this for, are very gratified by these procedures, and that in and of itself for me is very gratifying. The other aspect is I actually really enjoy doing it. I'm very passionate about providing a certain look for the patient, just from the artistic point of view. That's something I love doing. I'm a sculptor myself, and it's something that I'm able to create in life form for patients.
We talk a little bit, what I have to do, what I wanted to do, and I told him I want to do the tummy tuck, I want to do my breast down, and he gave me exactly what I have to do. I'm 40, I feel like 20. I never had that body. I think I look great now.
Board-certified plastic surgeon Dr. Kevin Tehrani is offering what so many women wish they had again, the body of their younger years. He and his staff at Aristocrat Plastic Surgery deliver natural results in a safe, state-of-the-art private environment. Dr. Tehrani performs some of the most sophisticated procedures at both of his New York locations.
The tuba procedure, or the transumbilical breast procedure, is one of the most advanced breast procedures because it gives you no scars that are visible. You make a tiny little incision on the inside of the navel, and the implants are introduced through that incision without any visible marks after everything is healed. One of the very exciting parts of breast aesthetics is fat grafting to the breasts. That's typically for a patient that wants a small to moderate increase in breast size, or patients that don't want to have any implants from foreign bodies in them. As safe as breast augmentation is, it's still a foreign body, and now we could use your own fat after sculpting your body, put it back into your breast, and give you a small, about a cup size increase in the body. One of the newest advances in breast aesthetics and breast lifting is use of internal bras. There's a specific one called Stratus that we use on the inside of your breast during a breast lift procedure. And I'm very excited to provide that option to selected patients that are actually good candidates for this procedure.
He just made me feel very comfortable, very warm, answered all my questions. It was no pressure, and totally loved him. I'm very happy.
I'm just gonna say to all the ladies to come and visit Dr. Tehrani because it's gonna change their life.
When choosing someone to perform such a personal transformation, trust only someone with the experience, knowledge, and passion for physical aesthetics. Trust Dr. Tehrani. To learn more or schedule a consultation, visit us online.